Hi, I'm Morne Christou, and this is Francois Burman, and you're watching the Dan Show. We're in the Seychelles at present, and we've come out here to have a look at the new chambers that the hospital here received. And as part of a service that Dan provides, we would like to make sure that all the chambers are fine, and that forms part of the RCAP program. And Francois is really the guy that started this program, and I'll hand over to him and ask him maybe in brief just to explain to us a little bit what the program's all about.
Hi, so as Morne said, I'm Francois Burman, and we're here really to do an assessment of the facility so that when we need to refer patients to a facility like this, we know what to expect, and our medics and our doctors have some idea of what services available to our patients that are referred here. The RCAP program is really a two-way program that is our extension of the Dan mission out to remote areas and specifically to facilities that make themselves available to treat our injured members or injured divers at large, as well as providing them with some essential information, risk assessment information, perhaps some training and orientation when they're not completely aware of what is the current modern practices of hyperbaric medicine and diving medicine. So we do an assessment for them. We point out to them what we believe could be some of the risks that they need to perhaps pay attention to. But more than that, we collect information for ourselves so that we know when we refer a patient and when our doctor has to refer a patient, we know what level of care that patient can expect. So you're sitting inside a very modern 2-meter diameter hyperbaric chamber that was donated to the Seychelles. In fact, there are 2 of them in this hospital, very, very well equipped. It doesn't appear that budget was any concern when they were putting this chamber together. It's a combination of what you'd expect to see for really good air diving as well as for hyperbaric treatment, and it's fitted with air conditioning and patient entertainment devices as well as all the necessary controls, firefighting equipment, and then manuals so you can manually control the pressure on the inside as well as controlling from the outside. Morne, what would you like me to kind of orientate you with in terms of inside the chamber?
Well, I mean, let's maybe take it. I've come to the Seychelles to do some diving, and next thing I know, I'm not feeling all that great. We phoned the Dan hotline, and kind of what's the step next? I guess the doctors start talking to each other.
Probably the most important thing to know is the first place we refer to is the hospital, and this makes this chamber ideal because it's located in the Seychelles main hospital. So our preference is to send the patient to the hospital for a proper medical assessment. If we need to have chest x-rays done to make sure that there are no other issues we're concerned about. But once everybody's satisfied that recompression is called for, then this chamber is now located in the hospital. The doctor and the staff are trained not only for the hyperbaric medicine, but any other emergency medicine that might be required. And what better place to see a hyperbaric chamber than exactly where this one is located?
Well, I think you bring an important point up there, is that we like to send the guys to a hospital first to get the basics done. And many times when I've sat in the office and Laurel, that manages our hotline, takes the calls, the guys kind of don't always understand, or our members don't always understand why that is important. You know, I take a place like Barn where there is no chamber facility, but they do have a small hospital and a clinic facility available. And I guess you've just answered that. You know, we want to make sure that everything is in place before we just send somebody to a chamber or evacuate them as such, I guess.
And really importantly, that a proper medical assessment is done. And we can do that much better with our doctor on call and a doctor on site than we can with our doctor on call referring them to a facility, a treatment facility that might not have a doctor that's available. We would rather the person went to a medical facility, had a proper workup, and the decision was made they do need recompression before we then send them onto a facility. Well, and it's much safer legally that way. We're applying proper legal principles.
Okay.
With the
so there's a medical and the legal aspect. Now, okay, so I've done all the checks and the doc says, okay, now we're going to put you in the chamber. I know part of the RCAP and then also these chamber training courses that we offer some of these facilities, we like to bring home the fact that certain emergency and safety drills are important when treating patients, whether that be divers or HBO patients or whatever the case might be. So I guess before the time there must be some kind of a briefing, I guess, made by some personnel or the doctor as such.
Well, all patients require firstly to provide consent, that they consent to be treated and that they know more or less what to expect in the chamber. Because they're to some extent locking themselves in a chamber with the doors closed and under pressure, and if something goes wrong, it's a bad place to be. Yeah. So they need to be orientated not only about what treatment they're about to get, but what are the safety requirements, what they shouldn't bring into the chamber, what they can expect inside the chamber, and if things go wrong, do they need to participate in dealing with getting out of the chamber if that's what's called for. So very important that patients and staff are well briefed before every treatment and everybody knows more or less what to expect, so that if surprises come along, people have some way of, same as you don't get on a boat without being briefed about life jackets and about basic emergency procedures. If you go diving, you get a diving briefing about where's your nearest port of call, what do you do if there's a problem. You do exactly the same with a hyperbaric chamber.
All right, so sort of basic kind of like before you get in, this is what you can and can't do and what you can expect, and I guess how long the treatment will be and how the treatment will be administered. So now I'm inside. I mean, I know from a DAM point of view, we prefer having somebody inside to look after the patient or the injured diver at the end of the day. But many facilities don't always follow that kind of recommendation. Is that a major concern or not really?
It is a concern. The practice usually, and I'm being very general now from a non-medical point of view, the practice usually is for a routine patient having, say, 20 treatments for a wound, their first few treatments that have somebody inside the chamber, and after that the facility is comfortable to leave them to fend for themselves. They know how to use the masks, they know what to do during the air break, they know how to sit and watch television, and they know what they shouldn't be doing. But for a diver, even if it's an experienced diver, and even with a follow-up treatment, the problem is they had an injury and we're now concerned about what might happen even during the second or third treatment. So the DAN preference would be that we only have tended patients, and that's the norm around the world, is that you don't send a diver into a chamber. Not even commercial divers would send one of their divers in for treatment without somebody on hand to, if they have a toxicity seizure. Remember, when we're treating divers, we tend to be treating in slightly deeper depths than they'd be if they were treating an injured patient. Okay. So we're already in the realms where oxygen toxicity becomes an issue. You want somebody on hand to take the mask off and to apply basic emergency procedures if that were to happen. So yes, the DAN preference is to have a tender.
And I mean, sort of let's say a general diving accident, obviously got different treatments, and as far as I know, we refer to them as treatment tables. How long are these tables, or how long can a guy expect to be inside a chamber for treatment?
Very much depends on whether he's been treated for an acute case of DCI and one of the associated conditions, or just some just really trying to make sure that he doesn't have some residual symptoms. So let's take a typical classical case of somebody with the bends. They would get a treatment table 6, a US Navy treatment table 6, which is a table at 2.8 atmospheres or 80 meters of seawater. Typically for about 2.5 hours is the time they will be in the chamber, maybe a little bit longer depending how long the chamber takes to get to surface. And they're going to have a series of oxygen treatments of 25 minutes, and then they'll either take the mask off to breathe air for 5 minutes, or they might switch on the outside the gas supply, so the diver will breathe air for 5 minutes. We try to prevent them from having a toxicity seizure because they are diving relatively deep for oxygen. So they'll be down at, as I say, 18 meters of seawater. That's getting very close to the cutoff of 20 meters where we don't like to go deeper in terms of oxygen.
Well, I guess all the more reason then to have somebody inside to look after that person. Now, one of the questions I've been asked by divers is, they like to dive on nitrox to enjoy their diving experience a little bit more. What about these guys? They're always worried now they come inside the chamber, are we going to get ox-tox even further? Is that a concern, or is that the doctor's problem?
Well, to some extent, most patients should behave the same at 80 meters. And if they're a diver and they're fit and they're used to different levels of oxygen, they should be even more tolerant to oxygen. However, that's very much a general statement. Every patient has to be assessed for what they've been treated for. The doctor will make a call as to what treatment depth they're going to use, and most of the time it's going to be in 18 meters of seawater, unless he's concerned about previous oxygen buildup. But as a general rule, Morne, we would stick to the traditional US Navy table 6.
All right. So it's quite a long time, and I guess even more so to have a good briefing so the guys know what to expect.
If I can just interject, for instance, when you need to go to the bathroom, you're stuck in here for a long period of time, we're going to give them fluids, although they will tend to dehydrate. They're going to need to pass those fluids. So part of the briefing will be when you need to use the convenience, there'll be some facility inside for you to do that, and most likely the specimen will be passed out to the people on the outside so we don't leave the waste on the inside, but you need to know what to expect, and that's part of your orientation before the dive starts.
Well, you were referring to this piece of or part of the chamber here. Maybe you want to just show us what that is and pass things through there.
So in essence, a chamber like this has either two locks, or mostly it'll have two locks. It means there's an entry lock and a main lock, so you can pass a person in and out the chamber without changing the depth, the pressure inside the chamber. But this is called a medical lock in medical terms, or a service lock in commercial diving terms, or an equipment lock. And what allows you to do is to put in something. If you're inside the chamber, the outside door will be closed. You put in your item you want to pass out, you close the door, and then on the outside they'll depressurize the lock and remove the part. So similarly, if you want to provide food or medication to the patient, this door will be closed and locked in the closed position. They'll confirm that using the communication system. They'll put it in on the outside, they'll pressurize this, they'll tell you when the pressure is balanced, and only then can you open the door to remove it. And of course the pressure is going to push this door closed, so it's impossible to actually open this if there's any, not enough pressure inside it to open.
And I guess then communication is quite important between, say, a person assisting the diver on the inside and then the guy operating the chamber on the outside.
Correct.
Well, I guess for non-technical guys, looking at all these valves and bits and pieces inside the chamber can be quite scary or daunting. But in fact, I guess once you break it down, it's a series of letting gas in, letting gas out, keeping it clean, I guess, and providing some treatment as such. So just looking at some of the things, I don't know, I guess these are sort of sample ports.
So the first thing to realize about being inside the chamber is thou shalt not fiddle. So we don't touch anything. Everything that you see here is mimicked on the outside. In fact, it's controlled on the outside, and the inside, these valves are purely here to close things down if there's an emergency. If you have a leak or something breaks, you could override the outside controls by closing on the inside. But this chamber's dived from the outside, and the only time you might activate something is to open the oxygen supply valves. These are the O2 supply valves to provide oxygen to the manifold over here, which goes then obviously via a demand and dump regulator to the mask on the patient's face. Otherwise, inside the chamber, we will speak, and you will not fiddle with the rest unless there's an emergency. So that maybe makes it a bit easier. In the modern medical chambers, we tend to not have these controls, assuming there are enough staff to take care of an emergency. But this chamber could be used for diving, where you'd have a limited number of staff. The divers are trained, and they know if I have a problem with an oxygen leak, I will then shut off the oxygen valve over here in an emergency, or if my safety valve is leaking for no reason and the pressure is still at the normal pressure, I can isolate the safety valve until they've had time to fix it. So that's really the complicated part of what you're seeing here. This is really the only part that you get involved with, and this is where we provide oxygen gas to the patient, and then the patient will exhale via a dump regulator, and the gas is dumped outside the chamber to keep the oxygen level in the chamber within what we call fire safe limits. We don't want to have an oxygen fire inside the chamber.
And are fires a risk inside the chamber? I guess small spaces, oxygen, alarm bells go off, I guess.
The problem is the door's closed. If you have a fire, you can't get out. You need to deal with a fire inside. It's not a more risky space, but yes, if you had a leak of oxygen and no one was paying attention, even though the air is analyzed on the outside and we know what the oxygen level is inside the chamber, if we have a leak, and then we need to get a spark. But of course, anything can really burn inside here, even when that doesn't look like it. So that our concern is, if you had an accident, then it becomes magnified. And of course, if you have an accident and there's oxygen and you don't shut the oxygen off, hence another reason for these valves over here, if you don't shut the oxygen off, you cannot put out the fire.
Okay.
So that's why we pay particular attention to fire. There fire suppression nozzles there. There's a portable fire extinguisher. Okay. If there is a fire, we refer to that as the F word. We don't like to use the fire word when people are in the chamber to make them nervous. It is the largest type of accident we've had in a hyperbaric facility, but it is far safer being in a hyperbaric facility than being a pedestrian or being a motorist, or these days looks like flying on an aeroplane. The number of accidents per treatment are incredibly small.
I guess it comes back to the management plan and training and making sure that everything is in place before you start, just like anything else, I guess. Now, you talk about sparks and stuff. I see there's a lot of lights. There's even some monitors inside here. aren't these potential sparking sources, I guess?
Well, you need to analyze what are the potential sparking source. The one you missed, Morne, is there's a little fan inside here, an electrical fan, and when fans spin, they tend to, depending on the design of the motor, they could be sparking on their brushes. But because this is designed in a hyperbaric environment, everything is very securely fastened. There are no switches inside here. The motor will be spark free, or a potted motor.
Francois, I don't know, maybe you got some parting thoughts on chambers, safety, or maybe just Dan in general before we say cheers?
Well, as a general comment, this certainly represents a unique type of facility in a region like this. Usually we get very rudimentary facilities, and we certainly don't have the cooperation for the medical people on the island per se. And what's really unique about this is in the main hospital with proper medical staff, proper medical support, and it's really ideal for divers to know about. In general, we struggle in some places with continuity of treatment. So we see a chambers put in the area, and then people tend to lose interest. And the missing link is usually the HBO. So if the doctors are doing HBO, then there tends to be a sustainable development or sustainable economy around the chamber, and the local Minister of Health is prepared to support the chamber because local people are benefiting.
Well, guys, I think just once again it shows you what Dan really does for the diving community. We try to go that extra mile, not just to provide you with hotline and medical advice, but actually visit facilities, work with them, and where possible try and make some recommendations to ensure that when or if you need to visit a facility like this due to some emergency or accident, that you're in good hands. But that's it for this show. Keep a lookout. We'll be visiting some other chambers in the near future. And thank you for watching The Dan Show.
Goodbye.
Goodbye.